Once your insurance company gives approval and our team clears you for surgery, we will schedule the procedure. Our staff will call you to schedule the following required classes and appointments. The first is a pre-surgery educational class, which is held in the Missouri Bariatric Services Clinic and lasts about 4 hours. It covers what to expect in the hospital, your surgery, and your after-surgery diet, as well as what to do if a complication arises and you cannot get to Columbia. Also, this is an opportunity to ask questions of our nurses and dietitian. Second will be your pre-surgery appointment with one of our surgeons. During this time, you may discuss any last-minute questions or concerns, review your test results, and discuss the risks and benefits of the surgery. Typically, your pre-surgery appointment will take place at our clinic the same day as your pre-surgery educational class. Your participation and attention at the pre-surgery class and pre-surgery appointment is extremely important. If for any reason during these classes we feel that for your safety you are not a good candidate for weight loss, your surgery may be rescheduled. Your final required appointment will take place at University Hospital with a member of our anesthesiology group to discuss and ask questions regarding anesthesia. Also, you'll have your last pre-surgery tests, including an EKG, a chest X-ray, and blood labs to make absolutely sure you are physically safe for surgery. Adjustable gastric band surgery is one of the procedures performed by surgeons at Missouri Bariatric Services. A typical stomach is the size of a football, so you would need to eat quite a bit of food to fill this space and send a sense of fullness to your brain. During the surgery, a prosthetic device is placed around your stomach to create a small pouch, thus enabling you to eat a smaller amount of food to feel full. Eventually, the food from the small pouch empties into the rest of your stomach and then your GI tract, which has not been altered in any way. Surgeons at Missouri Bariatric Services attempt to do all surgeries laparoscopically. As you can see in the video, the band is positioned around the stomach. You can also see the placement of the port, which is where we insert saline into the adjustable silicone band. The procedure takes the least amount of time to perform, and most patients go home the same day or the next day. On average, total weight loss for this procedure is around 40% of your excess weight. However, the procedure will not result in long-term weight loss if you do not receive the necessary band adjustments after surgery. These adjustments must be made by medical personnel. If you cannot make regular appointments to our facility for adjustments, please consider whether this surgery is right for you. Our surgeons also perform the Roux-en-Y gastric bypass procedure, which is the most commonly performed weight loss surgery in the United States. The procedure involves dividing the stomach and creating a small pouch, roughly the size of an egg. The small bowel is divided and attached to the new pouch. After the procedure, food moves down the esophagus into the small pouch. Then it moves on to the newly created roux limb and continues down into the small bowel. There, the food mixes with digestive enzymes from the pancreas and liver and is absorbed. The average weight loss for Roux-en-Y surgery is 70% of excess body weight. Also, the surgery improves many other conditions, such as an average 85% cure rate for type 2 diabetes, 70% reduction of high blood pressure, 80% reduction in sleep apnea, and a 95% elimination of high cholesterol. Please note that if you eat high-calorie and high-sugar foods, once they reach the small bowel, they are quickly absorbed and create a condition known as dumping syndrome. While not life-threatening, this experience is extremely unpleasant. Some people experience flu-like symptoms such as nausea, diarrhea, and stomach cramping. A third procedure performed at Missouri Bariatric Services is the vertical sleeve gastrectomy. It was designed for those patients whose BMI is greater than 60. This surgery removes a large portion of the stomach and creates a long tubular pouch with the remaining stomach. The small bowel is not divided as it is in the Roux-en-Y procedure. However, only a very small portion of insurance companies cover this procedure. So before you explore this option, please check with your insurance company to see if the vertical sleeve procedure is a covered benefit. It's important you be aware that weight loss surgery, like every other surgery, has risks. Bariatric surgery is considered major abdominal surgery. You will be under general anesthesia as the surgeon enters your abdomen. Missouri Bariatric Services surgeons perform a number of different procedures that change your body, whether it is altering your anatomy, removing part of your stomach, or inserting a prosthetic device. Complications which may lead to death or disability include pulmonary embolus, gastrointestinal leaks, and cardiopulmonary complications. Also, factors that increase your risks from weight loss surgery include previous weight loss surgery or upper abdominal surgery, higher BMI, and multiple medical problems. Missouri Bariatric Services mortality and complication rates are significantly better than national averages. We have an extensive program to reduce your risk for surgical complications. Our first and foremost concern is for your safety. There are ways to reduce your risk. Lower your BMI, do not have repeat bariatric surgeries, and decrease associated medical conditions. Also, extensive pre-surgery diagnostic tests will identify and help decrease your chances for serious adverse events. Unfortunately, there are a few conditions that will prevent you from having bariatric surgery. While these conditions are not particularly common, our first concern is your safety. These conditions include hepatic portal hypertension, unstable angina, severe valvular heart disease, chronic pancreatitis, chronic long-term steroid medication use, severe pulmonary hypertension, and congestive heart failure with an ejection fraction of less than 40%. If you are currently pregnant or addicted to alcohol or drugs, you are not a candidate for surgery. You must have stopped smoking before surgery. Smoking seriously inhibits your healing process and causes irritation, so you may be tested the day of surgery. You will also be required to be smoke-free for life after surgery in order to prevent serious potential complications. You may not be a candidate for surgery if you have severe COPD or inflammatory bowel disease, have attempted suicide within the last 2 years, or if your BMI is more than 60. If a test result or consultation determines that you are at high risk for an operative procedure, if the university hospital anesthesia staff feels you are at risk for surgical intervention, or if the Missouri Bariatric Services Clinical Committee deems you are unsafe for surgery, you may not be a surgical candidate. Statistics show that patients with a body mass index of more than 60 or who weigh more than 500 pounds have a higher incidence of complications and death after weight loss surgery. We want to ensure you are the safest possible candidate for surgery. So if you have met either of these criteria, you will be required to lose weight before surgery. Should you require medical weight loss, Missouri Bariatric Services offers a program to assist you. We offer weight loss classes and require you to attend at least 3 consecutive ones before you are considered for surgery. In addition, you may meet with our dietitian to develop a safe, effective, and quick way to lose weight before your surgery. On average, you will be in the hospital 1 night following adjustable gastric band surgery and 2 nights following Roux-en-Y or vertical sleeve procedures. If you have severe diabetes, you will be required to stay an additional night. Members of our bariatric surgical team will check in on you during your hospital stay to ensure your safety at all times. Your family may stay with you during your hospitalization, however, it is not recommended. Please ask the Missouri Bariatric Services receptionist for a list of hotels that offer discounts to the families of our patients. Before you are discharged from the hospital, our dietitian or clinical nurse will check on you to make sure everything is going great and make sure your questions are answered. For every night that you are in the hospital, we recommend you take 1 week off from work. For example, for Roux-en-Y surgery, there is a 2-night hospital stay, and so you should take off 2 weeks from work. Follow-up clinic appointments are required at 1 week, 1 month, 3 months, and then yearly visits for the next 5 years. We want to see you because we care about your success. From a medical standpoint, it's hard for us to tell how you're doing via phone calls. We learn a lot more about your health when we see you in person. There are many metabolic changes that take place in the first year after surgery, and we need to track these changes with you when you come to our clinic. Also, to help ensure your success, we offer classes for our patients 3 months, 6 months, and 1 year after your surgery to keep you on track. They usually last 30 minutes, and afterwards you will always see a physician. Classes are set up well in advance, so if you would like to know the schedule, please ask our staff. Our dietitian is always available to answer your nutrition questions and discuss your concerns via phone or email. Depending on insurance, you may meet with a dietitian one-on-one or in a group setting. Bariatric surgery is just a tool. What is essential for your future success is a lifestyle change. This includes changing your eating patterns, new dietary requirements, appropriate fluid intake, taking vitamin and mineral supplements, as well as increasing your physical activity. It is best if you can start practicing these new nutrition guidelines today. First, you must eat 3 meals each day and no grazing. This is where many people develop behavioral problems. Also, some people skip meals during the day and consume too large of a meal in the evening. Skipping meals slows down your metabolism and can cause weight gain. Secondly, your diet will consist of foods high in protein such as meat, poultry, fish, and beans, foods low in carbohydrates, low in fat, and sugar-free. Protein is the most important nutrient after surgery, so you should eat protein at the beginning of your meal as it helps you feel full and is needed to maintain muscle mass. Protein malnutrition, a condition where you do not eat enough protein-rich foods, causes muscle loss, hair loss, swelling, poor weight loss, and generally feeling weak. To meet protein levels, you will need to drink protein supplements. A list will be provided for you in education class. You need to drink fluids in between meals, but not with meals. Stop drinking 30 minutes before a meal and wait 30 minutes after a meal to drink again. After surgery, it will be important to drink 64 ounces of fluid a day, but no more than 1/2 to 2/3 of a cup within an hour. However, you may not drink carbonated beverages since the carbonation may stretch and potentially damage your stomach pouch. This includes, but is not limited to, beer and both regular and diet soda. You should begin limiting caffeine in your diet since too much caffeine will make it difficult to stay hydrated. Also, you should not drink with straws because they will introduce air into your stomach. Over time, this air may stretch your new stomach pouch, causing it to hold more food than the surgery originally allowed. Following surgery, you will be required to take specially designed vitamins and minerals. This will be covered in detail in class. Please note the cost of vitamins and minerals is not covered by insurance. However, with improved health, you most likely will see a reduced cost in prescriptions that can help offset the cost of vitamins. Vitamin and mineral deficiencies include iron deficiency resulting in anemia, vitamin B deficiency that may result in permanent nerve damage, nausea, birth defects, and general fatigue, and calcium and vitamin D deficiency resulting in poor bone health, including osteoporosis or anemia. So, let's review the steps to begin your journey with Missouri Bariatric Services. 1. Call your insurance company to make sure that bariatric surgery is a covered benefit. 2. Fill out your entire new patient packet and go to your primary care physician and have him or her complete the referral form. 3. Once you verify coverage with your insurance company and your forms are complete, call our office to schedule your first appointment.